recording right here in the GGF HQ studio in downtown Fredericksburg. I am Kristen Reed, and with me today we have non-invasive cardiologist at the Cardiology Associates of Fredericksburg and Chief of the Medical Department of Mary Washington Hospital, as well as GGF board member, Dr. Gregory Kauffman. Welcome, Dr. Kauffman.
Yes, thank you, Christine. Good to see you today. And thanks for Zooming with me today.
Not a problem. Zooming is the way these days, so thank you for joining us. So to kick things off, and before we get to brass tacks about your board membership, can you please explain to me, Dr. Kauffman, what a non-invasive cardiologist does? Yeah,
so a non-invasive cardiologist is a cardiologist who really assesses patients' heart and vascular conditions in a number of ways that really reflect, using safe modalities such as listening, talking to patients, as well as using different modalities such as stress testing, echocardiography, and imaging of the heart to assess cardiovascular disease, make treatment plans, and obviously treat folks when they're not feeling well. But certainly we are very committed in having folks stay healthy. So keeping people healthy and fit is also part of our mandate. And of course, we work in cardiology. It's a team sport, and we work with cardiovascular nurses, nurse practitioners, as well as other cardiovascular physicians who do other more invasive skill sets and surgeries and things of that sort. So but I'm a more of a generalist in that regard. Yeah.
Fantastic. Well, thank you for that, and thank you for taking care of all the hearts in our region.
Yes, my pleasure. It's certainly an honor and an enjoyment of mine, certainly.
Awesome. So shifting gears back towards the foundation now, we have a lot of great organizations here in our area, a lot of great causes. What drove you to Gweneths Foundation?
Yeah, that's a great question. Certainly I've had the pleasure of living with my family here in Fredericksburg for the last 25 years. My wife and I raising our family, and so we have enjoy really supporting local foundations. I had a chance to actually hear Joel Griffin, the founder, along with his wife, of Gweneths Foundation, speak really as a father of a very, very emotional talk about how he and his wife lost their child, Gweneths, to cardiac illness and cardiac arrest, and subsequently formed this foundation, and just the wonderful things they've done in such a short period of time, including leading the way for Gweneths Law, which is a law in Virginia, which certainly helps support having all high school students learn CPR, which is a fantastic thing, as well as all the other classes that they provide, including hands-off CPR and all the initiatives they have for really preventing what happened to their daughter Gweneths. The team had asked me to come aboard last year to help support their cause.
Awesome, and we're honored to have you. I'm glad you touched on Gweneths Law. The foundation here, we are the active arm to that law, right? So the law mandates that high school students are trained in CPR, that teachers are trained and knowledgeable and certified in CPR for public schools, and that all public schools have AEDs. So what we do is go out into the community and continue those efforts of ensuring that not just students and teachers are trained, but the entire community. So that's our mission, is to create a world where everyone could save a life. And we're able to continue on with that mission with supporters and board members like you.
Yeah. Yeah, and of course, the bystander CPR certainly is open to anyone who wants to learn. And that's the beauty of it. You don't have to be a healthcare specialist in any capacity. It's a rather simple task to learn, and it really empowers folks, to act if God forbid you come across someone in need, and certainly in this community, we know from patients that we've had come through the emergency room doors that it's life-saving. What happened on the streets when someone suffers a cardiac arrest, or and they're brought back. Certainly it's what's done in the hospital is only secondary to what happened there at the time of the bystander really getting them back into the harms of really the healthcare professionals to take over. So
now, personally, Dr. Kauffman, why is it important for you to serve on our board?
It's all about kind of giving back, of course, in terms of the time and effort that everybody puts in. And, that's a personal thing, in terms of being grateful and for the, what we have in our community, and giving back in an area that I can hopefully help guide the foundation with my expertise in the medical field, certainly, with the contacts that I've made, the folks I work with on a daily basis, all of whom, are committed to, healthcare endeavors, and so it's kind of a natural thing for me to be involved. So, and certainly I enjoy the folks I've met. A lot of them are, completely different fields, work in business, military, completely different fields that I work in, and certainly certainly appreciate everybody's point of view.
So we talked a little bit about what we're doing today here at GGF. Where do you see the foundation going over the next few years from your perspective?
Yeah, well, certainly with COVID, of course, every organization has had to, comply with the restrictions and the limitations put upon us by the pandemic. Right. And so the same is for GGF. There's certainly, this outreach of not being able to do CPR classes in the classroom, but kind of remote accessing and training is a phenomenal way of really kind of getting folks to continue the training programs going forward. Certainly you're looking at making sure that we have enough automatic external defibrillators, AEDs, in the community, and the fundraising done there is important. Certainly, the high school scholarships program, that's really phenomenal, really to given to high school students who apply perhaps for additional support going to college, and folks that are interested in healthcare specialties and so forth. And so really, obviously, giving money and time, directly the folks that you're impacting, hopefully, empowering our local high school students to careers, in the healthcare, and coming back and helping us as we grow older. Right. So it's a little bit selfish, but you want to have folks in place for you when you have the need. So there are really some of the things that are ongoing, and I know there's a lot of different fundraising activities that are on schedule as well, for engaging the community, and also obviously the financial needs as well.
So what, Dr. Kauffman, are you doing that you do in your personal life to stay heart healthy?
So what I do when I'm not, in front of a camera or on the computer or so forth. So fortunately, yeah. So I try to eat as balanced diet as I can. So I like my sweets and things, but certainly tend to eat as much vegetables. I'm not a strict vegetarian by any means, but and then really for me, it's more portion control, kind of eating smaller portions and being more strategic about what goes in, and certainly I do keep up a fairly significant exercise program. So I do have, and lately I've been cycling, with COVID and the YMCA, they're open, but there's some limitations there. So outdoors cycling, so that's been my new healthy obsession. Nice. With either alone or out with groups, small groups, in town. So we have a good time doing that, and that's been very enjoyable. So obviously keeping the exercise up and dieting and all the things that are important, to stay healthy. And actually, one of the best things about COVID, not the best thing, but one of the positive things, especially early on when most folks were inside their house, was that the amount of cars. There were no cars on the road, so it made cycling for the first 2 or 3 months of the COVID experience fantastic, because there really weren't many cars. So there's a lot more cycling going on these days, and certainly everybody sees cyclists around. So you have to be a little more careful about where you're driving. But
yeah, safety first, always.
Absolutely.
All right, Dr. Kauffman. Well, I know you're a busy man. We thank you so much for your time.
Sure.
With one more question for our audience to give them a little bit of a takeaway. Anyone out there thinking about supporting Gweneths Gift Foundation, what would you say to them?
If you have a group and you're interested in hands-on CPR, there's opportunities to get that training, and certainly I would recommend that, and that's done. Certainly there are donations that we ask and fundraise for. So really the best thing probably is really to keep track of some of the fundraising that's done. Friending us and knowing who Gweneths Gift Foundation is, and be involved in any way would be helpful. And again, the local organization, everything comes back to the Fredericksburg area, and certainly Gweneth was a native of Stafford County, her parents as well. So it kind of makes for a pleasurable experience. Giving back.